Hi, I'm Sebina Bulic. I do stroke and neurocritical care, and I'm Associate Professor, Keck School of Medicine at USC. It is my tremendous pleasure and privilege to introduce Professor Nenad Medvedovic. He has PhD in computer science. He is a chair of Department of Computer Science with RPNI School of Engineering at USC, and he's the author of innumerable peer-reviewed papers, recipient of awards and grants. And most of all, he is my high school friend. Neno, how are you?
I'm doing great. Thank you, Sebina. It's wonderful to see you.
Likewise. We have only 20 minutes and I have a ton of questions for you.
Okay.
So let's start.
Let's do it.
1996, Garry Kasparov beat Deep Blue in the game of chess. What would happen in 2022?
So in 1996, he played a 6-game match, and he won 4 of the games, which means that Deep Blue already beat him twice, right? In 2022, I don't think that realistically any of the top players, including Carlsen, who's considered maybe the best player of all time, could beat AI in a prolonged match that consists of multiple games. Maybe a single game if they got lucky, but not in a match.
Wow, computer science advanced that much?
It has. It's advanced along multiple different dimensions, which I'm sure we're going to talk about today. One of them is just the sheer power of processors that can be applied, so hardware basically that can be applied to solve a problem like chess, for example. But other things have had to do with actual advances in algorithms, artificial intelligence, software development, and so on.
That is fantastic, but our knowledge advanced as well. So
Yes.
maybe another match.
Yes, maybe we could have another match. And they do say that Carlsen is the best player of all time, which means that he is better than anybody who came before him. So who knows, right?
Yeah, who knows? I would really be looking forward to that. Question. What is artificial intelligence and machine learning? Is it like data in Star Trek?
So data in Star Trek had what they called a positronic brain. I don't even know what that would be the equivalent of today, but AI and machine learning as a particular part of AI are subdisciplines of computer science that try to generate knowledge from knowledge that we already have. And very often that knowledge is based on the data that, not the Star Trek data, but the actual information that we may have about a particular kind of problem. So machine learning, particularly since it's exploded in popularity, right? It is a subdiscipline of artificial intelligence that essentially focuses on trying to train computer algorithms to solve problems that they haven't seen before based on the things that we have seen before. So one of the very simple examples is image recognition, for example. So you have all of these algorithms that early on people now are facetiously saying focused on identifying a cat in a photo, right? And they could do that by basically learning from all of the existing photos or some large number of existing photos where there would be cats and they would be tagged as such in a photo, so that the algorithm could then take that information and figure out where all the cats are in any photos that it hasn't seen yet. But of course, the actual real world applications go way beyond that, and they're actually incredibly impressive. The field has advanced a lot in the last 15 years or so.
Yeah, I can vouch to that, and we will talk later about that. There is a fear that artificial intelligence will steal human jobs. Is that possible?
Well, anything is possible, but I don't think it's very likely. Certainly not within our lifetimes. Artificial intelligence is still very limited in its applications. There are lots of things that we don't know how to do very well in software, meaning that we really have not figured out how to build AI to solve specific problems. And there are lots of domains in which human intelligence is still vastly superior to artificial intelligence. It goes to our ability to understand problems. It goes to our ability to think about them critically. It goes to our ability to react to things that are based on our experience, based on our cultural norms, based on our ethical norms and things of that nature. I don't think it's realistic to expect that at any time soon any of those things would be actually transferable to some kind of AI algorithm. So I think our jobs are going to be, at least in many different domains, they're going to be safe for some time.
Talking about AI and prospect of helping us or taking our jobs, let's repeat that. Can artificial intelligence be dangerous?
Well, it can, and there are very mundane reasons why that might be the case. So a typical kind of example that people bring up when you talk about, let's say, self-driving cars, right? So you have an automobile that is driven completely by an algorithm that might be very smart. It might work in nominal cases, but what happens when that algorithm has to decide whether to hit a pedestrian or to swerve and potentially hit 5 people sitting in a sidewalk cafe, right? So how do you make that decision? As humans, it's very hard for us to codify how those decisions are made, and who knows how we would react in such a situation, right? But when you put it into software, somehow, somewhere, that knowledge has to be encoded, right? So since we don't understand fully how we operate within certain types of scenarios in the real world, we just don't know it, right? We can't put numbers onto the value of human life or injury and its severity and so on. We basically rely a lot on our, as I already mentioned, our ethical norms, our societal norms, and then of course our own judgment, and we make mistakes all the time, right? So that's one reason why AI can be potentially dangerous, is because we are flawed and we build these systems ourselves, right? The other reason it can be dangerous is that there's this presumption that AI itself is going to be bug-free. In other words, it's going to do exactly what it's supposed to do. So my training is in software engineering. I've worked in the field for about 30 years, and one of the things that I have studied during this entire time is why software systems are so, very often, so poorly designed, why they exhibit so many bugs, why they don't do what they're supposed to do. Since AI is also software, then at least for those specific reasons that I just mentioned, it is highly likely that we would have bugs in AI systems. Therefore, by definition, they're going to be dangerous.
Artificial intelligence became standard in medicine with neuroimaging and stroke, either stroke and neurocritical care, and we rely heavily on those processed pretty pictures of pink and green and vessels that are cut off. Do you see artificial intelligence influencing the rest of medicine?
So that's actually a very good example that you bring up. It is, on some level, it's reducible to image recognition, right? And image recognition and computer vision are two sub-areas of computer science that have gained a lot of benefit from AI and from machine learning. So there are sub-disciplines within other walks of life, within other scientific areas such as medicine, where there are going to be problems that are going to be more directly amenable to those kinds of techniques, and then there are going to be other problems that are not. So yes, I can see AI being applicable in all kinds of domains, from cancer diagnoses, for example, to some aspects of clinical care, to things of that nature. But then, at least for the foreseeable future, I can also see artificial intelligence being, at best, kind of an informative tool, but not something we would use directly in many other aspects of medical care. One of the things, of course, that people talk about, when you're a medical doctor, I'm not. So I'm a consumer of the kind of care that you provide. People talk about, your bedside manner, right? Things like that are very much based on human contact, and this is not something that AI would be able to provide ever, in my view.
I was very fortunate to have you as my mentor in one of my projects, where we looked at electronic health record in predicting culture-positive infections in neuroscience ICU. And we were very surprised when we saw that data points that we were completely not counting on became very important in algorithm decision making. do you foresee that AI is going to help us recognize some trees in a forest that we don't see, and we're going to eliminate commonly used predictors of certain conditions that did not pan out that well in AI algorithms in predicting any kind of disease process state and so forth?
That's likely because these are incredibly complex phenomena, and they depend on many different criteria and many different kinds of data. And this is something that humans are not necessarily as good at as computers are. And one aspect of computers obviously is the types of analyses and types of processing that happen through AI. So what algorithms are very good at is this ability to take huge amounts of data and process it in a consistent way. Humans are not as good at that. We're good at identifying patterns. We're good at tying things together, figuring out what the relationships are to the things that we know, trying to understand the similarities with phenomena that we have seen before, etc. But when you have large amounts of data, we're quite likely to miss some of them. And then the other thing that happens, I think, in different facets of science, in different scientific disciplines, and certainly in medical research, is we end up trying to do the best that we can with the information that we have. So we establish processes and procedures and formulate knowledge that is based on what we think we know. And part of the process here is to try to figure out what AI tells us so that we can adjust these things. So I'm not a medical researcher, but it seems to me completely expected that at some point going forward, things that don't seem to work well, or things where we did not use, we meaning medical researchers, not myself, optimal information, optimal knowledge, that would actually be adjusted as you go forward. And I think that's the very nature of scientific research, including medical research.
So traditionally, you had doctors on one side and engineers on the other side. And it seems to me that there is a new era where medical doctors have to have certain amount of engineering knowledge and vice versa in order to cross this bridge and serve medicine with these new technologies.
This is true. It's not uncommon, and you and I have spoken about this as well, it's not uncommon for medical doctors to want to learn statistical methods or learn programming languages like R, for example, or Python, so they can actually code up some of the hypotheses that they may have and study them, build models and study them in a computing kind of setting, as opposed to having to work with live patients or I don't even know, lab mice or whatever the case may be. I think that part of it is absolutely clear. So one of the things that we have to do, and we're doing, for example, in my department, is we're trying to understand how we can build bridges between our discipline, which used to be just a separate discipline where engineers would come in and they would learn what they learn and then they would go get jobs, how to build a bridge from that old way of conducting computer science and computer science education, and this newer way where many people who are not computer scientists by trade actually need the tools that we can provide so they can do their jobs better. And I think that really is the way of the future. And as you already know, within USC, for example, we have a data science program that has a direct bridge to the Keck School of Medicine, for example. So that's one of the programs that we have.
That I was applying to.
Yeah, there you go.
So can you explain it to me? How does AI work and ML? Is it you have a bunch of data and like in cartoon, you put it in a box and cogwheels are turning, and they spill out something?
Very often it is, and one of the things that we are trying to understand nowadays is that's something that gets spit out from that black box, which is really very often a multi-layered neural network. So it's a bunch of simulated neurons, essentially, which are little, you can think of them as little bits of software that will take that data and process it in a predictable way, but there's so many of them And then there are also multiple layers, so that by the time you get this result, one of the things we're struggling with, computer scientists are struggling with, is what they call explainable AI. What you'd like to understand is why the result that you're getting is whatever it is that you got. And that's very important because we're not at the point where we can trust our models, right? So a model could just spit out something that's completely wrong. In the case of a self-driving car, it might in fact, swerve to the left, for example, and cause an even bigger accident than the one that it's trying to avoid. So that would be not a desirable outcome. So from that standpoint, what you describe is true, but part of it, at least at a very high level, we take the data that we have, we try to learn from it using this very sophisticated machinery, these sophisticated simulated neurons, if you will, organized in multiple different layers in this architecture, and then from it, some result is going to come out. Having done some work in this area, I can also tell you that when you compare that for many different kinds of problems, for example, the kind of problem I'm interested in right now as my lab is identifying security vulnerabilities in software systems. The kinds of result you get out, even with pretty sophisticated models, could be, for example, 85% accurate. I don't know for what facets of medical care 85% accuracy may be acceptable, but I could imagine some for which 85% accuracy is not good enough, right? You need accuracy that approaches 100% in order to conduct certain very sensitive kinds of procedures. So we're learning, we're trying to understand first what the limits are of the applicability of all of these techniques, because they seem to offer a lot of promise. But we're also trying to understand, when we get certain results, why we're getting those results. And this ties back to your other question from a second ago, which is, what if AI tells us that we've been doing something wrong or incompletely for a really long time? At that point, the first question one should always ask themselves is, should we trust the AI, right? Maybe the AI, the algorithm itself is wrong, right? Maybe you've been doing it right the whole time. Once you verify that, and how you verify that's kind of it's black magic in a sense. It depends based on various fields. So how I do it in my research may be different from how you do it in your research, for example. Once you verify that, at that point you can maybe start applying some of these techniques in practice.
Coma is largely unexplored and mysterious, and we're talking today as a part of programming for World Coma Day. Coma is a spectrum of awareness rather than fixed and well-defined condition. How can artificial intelligence aid us in diagnosis and prognosis of coma?
So let me preface my answer by saying, obviously, again, I'm not a medical doctor. I understand coma from a layperson's perspective, but I also do understand this idea or understanding that it's really a spectrum. And one of the things that we have been very good at in modern medical care is collecting lots of data about patients, right? So we can measure a whole bunch of different things, from brain signals to heart rate to blood pressure to a million other aspects of a human body. And one of the opportunities this presents is to take this wealth of data and try to figure out whether and to what extent there could be correlations or even causal relationships between certain kinds of, let's say, states of a patient and whatever might be happening in terms of their comatose state at a given point in time. And I feel that at the least it can provide some insight into what might be happening with a patient, whether that translates into treatments, for example, and our ability to deal better with these patients, some of whom might be in a coma for a really long time, for example. Those are the kinds of things that I'm not qualified to speak about, but I can definitely see as a situation where this is going to be amenable to some kind of processing by AI and learning based on the wealth of data that we probably have at this point from kind of historical data banks, if you will, and that we can amass about any one individual patient who typically in a modern ICU, I see it on TV all the time, thankfully I don't have to visit one on a daily basis, but they're strapped to a whole bunch of different equipment, and there is a bunch of beeping and a bunch of spiky lines happening all over the place and so forth. That amount of data should translate hopefully to something that can be gleaned. And if software and AI can help to at least point medical researchers in the right direction as to where to look and what to look for, I think that would be a huge win for everybody.
So there are significant strides in use of AI in a coma sphere with neuroimaging and EEGs. But I also hope that AI is going to help us with everything else that we have in electronic health record, from heart rate to sodium level to nurses' notes. And all of that is largely overlooked, and that wealth of data will hopefully further our efforts in curing coma. I am enormously thankful to you for this time that you allocated to me and answered my questions. And I truly hope that everybody else there is going to enjoy this segment as much as I did.
Thank you so much. It was such a pleasure.